Maison de Naissance, home of birth, bringing healthcare to the woman. Maison de Naissance, referred to throughout this piece as MN, is an NGO that has developed a culturally safe maternity centre effectively aiding childbearing women and babies to overcome obstetric and neonatal obstacles faced in recess poor rural Haiti. The women-centred and empowering organisation focuses on preventative healthcare, providing education regarding family planning as well as antenatal and postnatal education. The organisation is staffed completely by Haitian women, thus empowering their community and providing culturally safe, effective care. Previous to the development of the organisation, being pregnant and delivering your baby in Haiti was dangerous due to a lack of services, equipment and skilled healthcare workers. US-based doctors Dr. Elizabeth Wickstrom and Dr. Stan Schaffer undertook a medical mission through impoverished Haitian communities, providing high-quality obstetric and neonatal care and education to an area where it was otherwise absent. Upon the realization that their impact ended when they left, they established MN in 2004. The principles that the organisation strive to achieve include high-quality maternal and infant health care, family planning and HIV/AIDS screening and treatment. The centre can be accessed 24/7 and has no financial barriers. With this, alongside the establishment's cultural safety, the care is optimal for Haitian women and the impact is recognised as significant by the World Health Organization and the Haitian Department of Health.
MN's successes rely on their ability to move healthcare to the patient rather than patient to the healthcare, provide high-quality care in poor rural areas, and introduce the internet into communities that were otherwise still without electric necessities, such as lights. Care is integrated into the community and into their homes, therefore ensuring it is culturally appropriate, rather than potentially intimidating the women by routinely transferring to the facility. They aim to provide continuity of care throughout all these services, through from family planning to childhood vaccinations. MN strives to support women post-delivery and aims to provide around-the-clock consistent care. The facility has up-to-date technology using electronic medical records, while obstetric and neonatal specialists are contactable by telemedicine.
The fees of the medical centre are set by the community, some care even free for those who cannot afford it, therefore ensuring that all women are cared for and not discriminated against due to their economic status, thus addressing the United Nations' first Sustainable Development Goal, no poverty. MN's aim is to prevent maternal and infant deaths by being accessible and providing reliable health care to both women and babies. This addresses the third goal of the UN SDGs, good health and well-being. Once this goal is achieved, their mission is to ensure that the programs are self-sufficient and that the community is able to manage these services independently, therefore addressing the SDGs' 11th goal, building sustainable communities. MN also helps to achieve the UN SDGs by addressing quality education through both nursing and midwifery education for Haitian women, but also through education for childbearing women and the community. MN also provides clean water for all patients in an area that would otherwise be without, aiding to the achievement of the SDG's 6th goal for clean water and thus improving hygiene in the community.
Since 2004, Maison de Naissance has been recording outcomes in epidemiology in order to monitor the successes of the services and goals. Their successes include an increase from 51% to 99% of prenatal care rates for pregnant women, and an increase in the number of births attended by a skilled birth attendant have risen by 78%. Furthermore, with over 4,700 deliveries, the maternal mortality rate remains at 0 and their neonatal mortality rate is less than 2%. MN measures its successes based on feedback surveys from women who are now embracing the available services. Women have been able to access these services and barriers have been removed, resulting in an improvement in pregnancy outcomes. The strategy has proved to be so successful that the organisation is hoping to replicate the model in other locations, both nationally and internationally.
MN is always on the lookout for people who are interested in helping them provide safe and effective care for women and babies. Funds and vehicles can be donated to Global Birthing Home Foundation. Lastly, volunteers are welcome in Haiti to provide hands-on assistance to the women and the organisation.
MN has successfully empowered the Haitian community to sustain modern and effective healthcare and is seeing recognisable success through epidemiology, recognised as significant by the WHO, the Haitian Department of Health and Community. The impact of the organisation on an otherwise resource-poor rural area has been a huge contributor working towards meeting the UN SDGs.